Hello, I am Shalina. Today I'll be performing inserting and removing a nasogastric tube and internal feedings. So first you will verify doctor's orders. Also identify the patient via armband, name and date of birth. Ask the patient if they have any allergies and check the identification of the patient against the procedure card. First you would perform hand hygiene and don clean gloves. My patient is already in a high flyers position. The towel is draped around her and she has her basin here. And I have water and ice chips if she's able to swallow to help assist the tube down. Okay, now we will check the nares. Check the nares, making sure they're patent and the patient is able to breathe out of both nares. We will measure the tubing from tip of the nose around the ear down to the xiphoid process, and then we will mark this spot. Okay, now I will lubricate this tubing 3 to 4 inches down. Now as I'm inserting, I will have my patient to tuck her chin, inserting it in a downward, backward motion. My patient can drink water or ice to help assist the tube down if she can swallow. And if the patient becomes distressed by coughing, gasping, or inability to speak, I would stop inserting the tube. Now we will secure it with tape. Okay, now that my tube is secured, I will withdraw some gastric content. Apply this onto my pH strip to verify placement, and I will also call and get a chest x-ray to verify placement as well. And you can secure this tube with the NG tube holder or tape, and I chose tape. So after your chest x-ray report has came back and your tube is in the correct place, you can now attach this to suction or a feeding pump. Okay, now we'll remove gloves, perform hand hygiene, and I will document the size of my tube, the nair that I chose to use, the type of tube, description of the gastric content, verification of placement, and my patient response. Now we will move into the internal feeding. So my patient is identified already. I explained the procedure to the patient. Orders are already verified. We will perform hand hygiene and apply clean gloves. Now I will prepare my feedings by shaking it up and then pouring it in the designated container or bag. Okay, now we will check placement of the tube by inserting 10 milliliters of air to facilitate residual removal. Now we will remove gastric content, apply it on my pH strip to test and verify placement. Then we will remove all of the residuals that the patient may have. If the residuals are less than 250 and greater than 500 milliliters, or within 2 checks your residuals is greater than 250, you would discontinue the feeding because the patient is not tolerating it or digesting it. So then you will replace all your residuals back. Now, you will draw up 30 milliliters of water to flush the tubing. Inject that slowly. Now I will pull up my feedings, and I will be using the gravity method. And even though this is a bolus, I will allow my feeding to flow by gravity. So another way is by using this bolus, I could just push the feeding in slowly. And if I had a feeding pump, the pump will be here attached to the IV pole, and it will have tubing attached to it as well, and the feeding will just flow through the tubing per doctor's order. And it will also have a bag with water in it attached in order to use that bag to flush the tubing. And then it also has a setting that you can prime your tubing before starting the feedings. Now my feeding has went all the way in. We will draw up 30 milliliters of water to flush. I'll inject that slowly. So you will flush with 30 milliliters of water every 4 hours during a continuous feeding. The pump will regulate that. And then for intermediate feedings and medications, you will flush 30 milliliters before and 30 milliliters after. And you will check your residuals every 4 to 6 hours. And you will also change your feeding bag and tubing that is connected to your pump every 24 hours. And if your tubing was inserted abdominally, you will assess and clean that site daily. And for conditions that my patient would need an NG tube is if the patient has an intestinal obstruction, and the tube will help decompress the stomach. If my patient has ingested some toxin substances or has a GI bleed. Okay, that procedure is done. So I will remove my gloves, perform hand hygiene, and I will document the feeding, the residual appearance of site, if the tubing was placed abdominally, if my patient became nauseated while getting the feedings, and also document the INO. Now we'll move on to removing the NG tube. Orders are already verified. Patient is identified. I explained the procedure to the patient that I will be removing this NG tube. Now I will perform hand hygiene and apply clean gloves. Okay, now I will disconnect and clamp this tubing from the feeding tube or suction. And then my towel is placed here already. Now I will ask my patient to hold her breath as I remove the tubing slowly. Then I will dispose of this in a biohazard bag. Now I'll perform mouth care and nostril care and dispose of this as well. Now I'll remove gloves and wash my hands and document the procedure, how my patient tolerated it, the size, which nail that I use, and the type of tubing. Thank you.